Hi everyone, this is Dr. RadhaLakshmi Senthil. Today I'm going to talk to you about COVID-19 in children, the need of the hour topic during this pandemic. I'm sure all of you are very anxious how to manage your child, whether every fever is COVID or not, and if it is COVID, what to do with your child and how to prevent transmission to other family members. Today's Indian statistics is we have 4,42,000 confirmed cases, of which we have reported 14,000 deaths, which equates to 3% of total death. However, across the globe, children less than 18 years contribute to only 2% of confirmed cases, and the death rate in children reports to 1 in 10,000 confirmed cases. So that is negligible number. However, even that one case becomes very significant for us. So let us now see, when will you get alerted? How do you manage your child if you suspect COVID-19 in your child? Largely, children are asymptomatic, so they do not present with any symptom. Their body is designed in such a way they cope very well with viral infections. So what symptoms do they present with if they become symptomatic? Often they are still a mild disease, and 50% of the children present either with fever or with cough. Roughly about 30 to 40% of the children present with running nose and sore throat. 10% will present with loose stools and vomiting. Lot of time, these symptoms are easily manageable at home and they are similar to any other viral flu-like symptoms. So COVID-19 is not any different to any of the other respiratory tract infections which you may have seen in your child in the past. So do not panic about it. All fever is not necessarily COVID-19. If you think your child has got fever, start maintaining a temperature chart. This will equate to a hospital admission where your child is constantly being monitored. Every time your child spikes a temperature, record it with the date and time so that it is easy for a clinician to assess the magnitude of the illness in your child. Please make sure that your child's fever is relieved with paracetamol. And during this time, make sure your child is having adequate fluids, roughly about 1 to 2 liters. Younger the child, about 1 liter. Older the child, it should be roughly about 2 liters a day. Encouraging fluid will actually flush the system and keep them well hydrated and well nourished during this period. You may choose any fluid, be it a soup or warm water, warm tea, fluids like buttermilk, tender coconut water, milk or juice. Ensure normal diet. Whenever a child is unwell, it is extremely difficult to get a good appetite. So during this time, please give fever medicine to reduce his temperature and improve his well-being. Choose that time to feed your child with certain amount of food he could manage during this period. If he is unable to take solids, kindly encourage plenty of liquids in a frequent interval. Please also make sure this child takes regular body bath. Giving a body bath will give refreshment to your child and improve his well-being. And ensure your child is active in playing and passing urine adequately. If your child is older enough, encourage a gargling. Throat gargling would be useful. You can use a salt water gargle or a betadine gargle. Steam inhalation will be extremely useful because a lot of time the virus colonizes in the cold part of your body, which is actually your sinuses and your nasal cavity. So encourage for a steam inhalation in older children at least once or twice a day. In the event of cough, kindly get a doctor's assessment to see the magnitude of illness. If there is any other respiratory tract manifestation apart from a simple cough, it would be ideal to get assessed by a doctor. He might require a chest x-ray or a further imaging which will need your doctor's attention, or even an antibiotic might be required at this point. Very rarely across the globe, there is a small percentage of children who are reported with critical illness and COVID with a presentation you may have heard as Kawasaki or a toxic shock syndrome, and there has been one case reported in Tamil Nadu recently. So how do I identify this in my child? If you have a persistent high spiking temperature and your child is unwell with a reduced urine output, you should be definitely at your doctor's place, rather admitted in the hospital for a close monitoring. Even the one case which was reported in Tamil Nadu has shown an excellent recovery. So by and large, children do extremely well with the outcome of this viral illness. So what will happen if my child is unwell? Does my child transmit infection to the others in the family? This is quite a difficult question. There are different research telling different answers. Some of the research says that children do not transmit infection essentially to the adults. However, this is being disputed. Until we get clear information, we should consider children as a potential transmission risk to the other family members. If you have a family member who are elderly or a family member with diabetes, hypertension, renal disease, obese, asthmatic, it would be absolutely a safe option to keep your child who's unwell with fever away from these family members. It would be ideal only a single adult takes care of this child who is sick, so that you can quarantine the child for at least 14 days with that adult member. Children above 2 years, please encourage the child to wear a mask, and the adult also has to wear a mask to reduce the risk of transmission to the adult. Please make sure that you use an alcohol sanitizer on a regular basis every time you have contact with your child. There would be definitely a high chance that the adult might contract the virus from the child. However, as of today's date, we believe the transmission from the children to adult is practically negligible. So in summary, children with COVID-19 have got an excellent outcome like any other viral infections. And to add on, the newborns who are born to mother who is COVID positive are doing extremely well without any clinical symptoms or signs. So altogether, let's face this pandemic situation more confidently. Thank you.